Welcome back to my channel. So today's topic is postpartum depression. So let me give you more details about what exactly is postpartum depression today. So most of the mothers after pregnancy and after delivery, most of them go through this stage of postpartum depression, and this is a real thing. Most of them do not share it, and some of them undergo this and lead to a lot of issues to them. So let me give you more details on this particular issue today. So postpartum depression is a mental health illness basically, and this usually happens to mothers. This is other side of your motherhood. So this might happen not only to people with mental issues, but also because of the stress that they're going through. They're going through a complete new life. It's a complete change even for them, which is a new thing for them. This becomes very difficult for some of the people to get adjusted. So people who adapt quickly and adapt to the changes quickly, they may not have this issue. But some people who are very rigid, who find it very difficult to change to conditions, they may undergo these kind of situation. So in this particular stage, they may feel sad, they may start crying suddenly, they may have the loneliness in them, they may feel that they are worthless, restless. These are the basic symptoms which is seen in these kind of women. And basically they have a lot of mood swings. It will be very difficult for them to attach to their kids because they themselves will not be knowing what's happening to them. They will have very low concentration, they cannot concentrate well, they have a poor appetite, they cannot sleep properly. So these are the basic things that happen when a woman is facing this kind of situation called as the postpartum depression. So this usually happens after delivery, most of the cases, and it might continue for even months. So if this happens within 6 months of childbirth, this is told to be as postpartum depression. So coming to the types of postpartum depression, there are different categories again in this. One is called as the baby blues. So this is seen in most of the women. At approximately 70% of the women go through this particular baby blues. So in this particular case, they don't know how to manage. So they will be very anxious. So anxiety is there. How will I manage? Those kind of issues will be there. So that can be solved by joining some groups. Like there are a lot of groups available. By joining those groups and watching the contents in those groups, it will help you in coming out from this situation and trying to manage the situation which you are facing. And one more type is the postpartum depression, which I told you. But in this particular case, the symptoms that I told you, that will be very, very strong. So suddenly you start crying, suddenly you don't know what's happening, you cannot connect to your baby. So these are the basic symptoms seen in postpartum depression. One more type is postpartum psychosis. This is really a very serious mental health issue. So this can happen again after childbirth. And in this particular situation, you may have hallucinations. Again, you may have no connection with your kid. You may hurt yourself or you might hurt the kid. So this kind of situation can also happen. So which can be a dangerous thing. So what basically causes this postpartum depression? So let me tell you something about that. So basically it is because of the hormonal changes that is happening in the women. So during pregnancy, a lot of hormones are going to get enriched in your body for making you ready for pregnancy and for delivery. So estrogen and progesterone, these are the female reproductive hormones. So during pregnancy, these hormones, there will be basically tenfold increase in this hormone. So there's a lot of increase of these hormones happening. So these are leading to various other conditions which are required during pregnancy. And what happens is immediately after delivery, this hormone drops sharply. So this sudden changes in this hormonal level leads to a lot of complications because these are chemical signals, chemical changes, and because of which it might lead to depression in case you're not ready for all this. Okay, so this becomes a depression situation to some of them, but not all. Not only that, your social changes, no support from the family, or psychological changes also can lead to this particular issue. Apart from that, your lack of sleep. So this is again a thing which might be there in almost all the cases, because even the baby is new to the world, their sleeping patterns will be different, you need to get adjusted to that, so because of which you might be sleep deprived. So this is one more basic reason. We know if we can't sleep for 1 or 2 days, how crazy we can act. So same way here, when they cannot sleep for long, it leads to a lot of trauma in them, which might lead to issues. Not only that, anxiety, as I told you, whether I'll be able to take care of my baby, whether I can manage. So these kind of anxious behavior which is there in women also can lead to a lot of issues. And one more thing is that their self-image might be low now. Because of pregnancy, they might be obese now. They might lose their attractive nature. They might get stretch marks. So all these might again create a lot of issues in women, because many of them are beauty conscious. So when it comes to beauty conscious and these things happen, they may not be able to take that, and that also might lead to a lot of issues. So coming to the symptoms of postpartum depression, most of them I already discussed with you now. So this is just to show you that. So you might feel low, you might start crying, you might feel restless, you might lose interest in anything, you might feel you're worthless, hopeless. So these are the basic symptoms seen in these kind of people. Not only that, they cannot get attached to the baby, and they will have even hallucinations. So this is also a symptom which is seen, where you'll be seeing or hearing something which is not present. So these kind of symptoms are also there. And sometimes you may have weight loss which is unexplainable, or you might have unexplainable weight gain. So this also is a symptom of postpartum depression. So basically, who are at risk? Okay, so as I told you, the people who cannot adapt to changes quickly, they are the people who are at risk basically. And sometimes it might run in family also. So family history of these kind of postpartum depression, if it is there, that might continue. And if you do not have proper support from your family to take care of the baby, that also might lead to these kind of situations. And the sex hormones and the stress hormones, as I told you, some changes in that levels also can lead to this situation. So we all feel that only women go through this, but let me tell you, even 4% of the fathers experience this kind of depression situations after childbirth. So one reason for that might be the financial difficulties if something is there, job security if it is not there. So these kind of situations also can lead to depression in fathers also. But let me tell you, if you think that if you can avoid it or prevent it, it is very difficult, because if you cannot adapt yourself, it might be difficult for you to prevent or avoid it. But if you try to change yourself, try to build a healthy lifestyle and start preparing from beginning itself for the tough times, so that you are ready. So anytime if you are ready to do something, your mindset also changes and you will be ready to do anything. So in this way, quick adapting to situations might help you in this particular case. So some more risk factors, as I told you, can be if the female has these kind of, not postpartum depression, if she has any episodes of depression prior to her pregnancy, then the chances of postpartum depression can happen after pregnancy. If the age is too young, if she's too young for pregnancy, or she's might be after 36, 37, 38 years she has got pregnant, there also the chances of this is more. And again, it can be very stressful if she's lost her job or any kind of such stressful events. If it is there, that also might be a risk factor. And if the child needs a special need, like if the child has got any health issues after birth, that also can create postpartum depression in the mothers. And if you have like twins, triplets, so in this way, if more kids are there, you will not be ready for it in case, then that also can lead to issues. And support system, as I told you, this is very, very important. So if you do not have proper support, this might lead to these problems. And marital conflicts also can lead to these kind of issues. So what should you do? When should you contact your doctor in case you feel that you're having these symptoms? So if you feel that whatever symptoms I told you now, you're going through this, may not be very high symptoms, but at least beginning of that, some of the symptoms you're seeing it, you have certain thoughts of having suicidal tendencies, you have a thought of harming your baby because of the situation that you are in. So these kind of things, if it is there, definitely you should consult your doctor, because they can give you better suggestions, they can give you proper guidance how you can come out from this situation. So in this way, it will be better if you consult your doctor in case you find these symptoms in you. So what are the diagnosis and treatment options? So basically doctors might give you a questionnaire. They might talk to you face to face, ask you some questions to find out what is exactly happening in you, or they might give you a questionnaire, and by your way of answering that questionnaire they get to know your mental status. Apart from that, they might do certain blood tests sometimes to find out the hormonal levels, because I told you imbalance in the hormones also can lead to these issues. And talk therapy is always there, counseling is there, and they might even prescribe you certain antidepressants which might be of some help. And certain times they might even give cognitive behavioral therapy. This is a therapy which is basically focused by these therapists, where they make you realize that you can think in a different way. So we basically think in one particular direction. So they give you different thinking styles, or they make you understand various concepts, and by that you can try to save yourself. So these are a few helpline numbers which might be of help in case you require it. So some things that you can do, I already told you about the other side of motherhood. So motherhood is really a blessing for everyone, but it can turn other way around, because in case you're suffering from this kind of issues of postpartum depression. So first thing you should do is you should find someone to talk to, whom you trust, and whom you can talk anything, like whatever you're feeling, you can share your feelings with them. So these kind of things is very important. So always don't think that you can do everything. Take help wherever required. Take support from the family. Have certain child care people if required for you, and find time for yourself. So once motherhood is there, don't think that you cannot do anything. It's only the baby with you. You can do other things also. You need to find time for it. So whenever you get time, whatever entertains you, whatever you are interested in, try to find some time, me time, and do something in that time, so that you can keep your mind fresh and do various things which can benefit you. Because once you are in good state, the entire family is going to be in good state. That you have to keep in mind. So keep a diary. In case you cannot share it with anyone, you can write it down. And in this way, you can let out your thoughts and frustrations, anything if it is there. In that way, you can get it out. So try to celebrate even if there is any small achievements. So this is going to help. And don't think that you are a super mom. Okay, this is important, because some people think that they only should take care of their baby, and that might lead to problems in you, because you may not be sleeping properly because of that, and because of that you might end up in postpartum depression. So it is not to do with money or something. So you can just spend some money and try to get some help for yourself also, so that on the long run you will not end up in this situation of postpartum depression. So it's better to talk to your doctor and get valuable suggestions from them and guidance from them. So these are some of the groups which might be helpful in case you are suffering from this particular postpartum depression kind of symptoms, initial stage also. There are certain groups which are available on Facebook. You can just have a look at that. Mom Stuff Postpartum Support Group, Postpartum Support International. You can join these groups, and there people keep posting their problems and people give them solutions. So just reading that, even you can start preparing yourself. And there is one more important group, which is Breastfeeding Support for Indian Mothers. This is also a very good group. I have also joined this when I was delivering. I had joined this group. One of my cousins suggested me for this particular group. It is really a good group where you get a lot of information. People share their problems. So many of them give their suggestions. So you can get a lot of information, plus you can prepare yourself for particular stages, so that you will be prepared for it, you start adapting it, and you live with it. So this is a basic thing that I want to share with you. So this will be a very good thing for everyone. So coming to the takeaway messages, it's always better to build a secure bond, take help whenever required, and slowly introduce whatever you were doing previously, so that you keep yourself busy, and in that way you can avoid these kind of depression situations. So don't hesitate to ask for help. So don't think you are a super mom, you can manage everything. You will definitely require for help. So take help wherever necessary, and family should definitely support the people, and they can help. Apart from that, psychotherapy or medication, in case it's required, please do take it, so that you can take care of your baby in a better way. Because if you do not do this, and if this continues, most of the cases this ends up in suicide or any other situation like this, which might be detrimental. So definitely you should take care of your health and talk to your medical professionals, and get better health care. So in that way, it's better to stay vigilant and stay safe. So thank you for watching. If you have not yet subscribed to my channel, please do subscribe to my channel. And if you have liked this video, please like this video, press the like button, subscribe and share it with other people, so that in case anybody is facing this issue with postpartum depression, this video can be some help of them. Okay, so it can help them in one or the other way. So please share this video. Thank you.